Manitoba has the highest rate of kidney failure in the country, driven by a disproportionate burden of diabetes in Indigenous populations and the chronic kidney disease that is often associated with diabetes.
They're not able to get access to proper services or the proper assessments. Those medical issues go unresolved or undetected until it gets to a point where it's at an acute state where they have to either be hospitalized or they're at the end stages where they have failure with their kidneys.
It's critical to do something about the epidemic of diabetic kidney disease in the Indigenous population in Manitoba and Canada.
Research Manitoba is excited to announce a new strategic partnership with Boehringer, Ingelheim, Canada to help improve diabetes health outcomes within Indigenous communities in Manitoba.
At Boehringer Ingelheim, we are committed to nurturing long-term sustainable partnerships that will help solve health challenges in Canada. And to address the unique Indigenous healthcare needs, we are facilitating the creation of transformational Indigenous-led programs.
Indigenous populations live mostly in Canada in rural and remote settings, so access to healthcare is an issue with inequality to primary care networks and screening for kidney disease and risk factor management.
There's no question that early screening is critical for early identification, early intervention that can include modification to risk factors, early treatment, to avoid or even delay the need for dialysis.
In 2010, at a routine physical with my family physician, I was diagnosed with nephrotic syndrome. My kidneys weren't working properly and I had 20 times as much protein in my urine as I was supposed to have.
The first project in this industry-government partnership is called Virtual Kidney Check and Follow-Up. It's a randomized controlled trial in First Nations adults in Manitoba to identify the best way on a population-based level to screen and identify chronic kidney disease early so that treatments can be initiated.
80% of the damage is done to your kidneys before you even know that you have kidney disease. And that's why a screening program is so important. I was able to be treated early and I am free of kidney disease.
I think identifying chronic kidney disease and diabetes early is going to prevent the complications of kidney disease and diabetes from a heart perspective, brain perspective, peripheral vascular disease. It's going to make a very big difference long term.
This partnership is a model involving communities and leaders within those communities to design projects that are going to matter the most to the people who live in those communities.
It's exciting because we'll be able to have input. We'll be able to give some ideas and suggestions on what we can do as a collective to improve our health care system.
Our partnership with Research Manitoba demonstrates our commitment to play a role in the sustainable improvement of health outcomes for Indigenous communities.